I need you to hear me clearly on this. Most people over 60 will not survive their first heart attack if they are alone, and they do not know what to do in those critical first minutes. That is not meant to frighten you. That is a medical reality. Nearly half of all heart attack deaths occur before the patient ever reaches a hospital. Not because the heart attack was unsurvivable, but because the person wasted precious time. They hesitated. They panicked. They did not know the simple science-backed actions that could have kept blood flowing long enough for help to arrive. Every week in emergency rooms across this country, patients are brought in who could have survived with minimal heart damage if they had just done one or two things differently at home in those first few minutes. A crushing pain in the chest, sudden breathlessness, dizziness and cold sweat. And by the time they arrive at the hospital, the window for optimal treatment has already closed. My name is Dr. Michael Williams, and today I am going to walk you through 7 life-saving steps that every senior must know to survive a heart attack when nobody else is around. These are not gimmicks or myths. These are real strategies backed by cardiology research that doctors teach their highest-risk patients. And the third step on this list is so powerful that research shows it can make the difference between permanent heart damage and walking out of the hospital alive. Let us begin with step 7, and it is the most critical action of all. Call emergency services immediately. Do not wait. Do not second guess. Do not tell yourself it is probably just indigestion or that it will pass in a few minutes. Every minute you delay, heart muscle cells are dying. Cardiologists have a saying that captures this perfectly. Time is muscle. The longer blood flow to your heart is blocked, the more irreversible the damage becomes. Research from the American Heart Association shows that patients who call for help within the first 5 to 10 minutes of symptoms have survival odds up to 50% higher than those who delay. Yet studies show nearly 1/3 of people over 60 wait more than 2 hours before seeking help, often because they do not want to bother anyone, or they convince themselves they can tough it out. That hesitation can be fatal. If you feel crushing chest pressure, sudden shortness of breath, unexplained nausea, pain radiating to your arm or jaw, or a cold sweat that appears without explanation, act as if it is a heart attack until proven otherwise. Pick up the phone and dial emergency services without waiting another second. Step 6. Chew an aspirin immediately if you are not allergic and have not been told by your doctor to avoid it. Not swallow. Chew. Aspirin is one of the most powerful clot-fighting drugs available without a prescription. Heart attacks occur when a blood clot blocks flow to the heart muscle. Aspirin works by thinning the blood and preventing the clot from growing larger, keeping some blood flowing until paramedics arrive. Research published in major medical journals found that taking aspirin during a heart attack reduced the risk of death by 23%. But speed matters. Swallowing an aspirin whole can take 10 to 12 minutes to break down in your stomach. Chewing it breaks it apart instantly, allowing the active ingredient to absorb through your mouth and stomach lining within minutes. One full 325 milligram tablet, uncoated, chewed thoroughly. Keep a bottle in an easy-to-reach location in your home at all times. Step 5. Loosen tight clothing and sit upright. This sounds almost too simple to matter, but the physiology behind it is significant. Tight belts, waistbands, and collars compress blood vessels and restrict the circulation your body desperately needs when your heart is under attack. Sitting upright relieves pressure on your diaphragm and lungs, making breathing easier and reducing the workload on your already struggling heart. Lying flat forces the heart to work harder, especially in seniors with existing lung conditions. By sitting upright with your back supported at a slight angle, you improve airflow, lower chest pressure, and allow blood to circulate more effectively. Step 4. If you feel yourself about to faint, cough strongly and repeatedly. This technique, sometimes called cough CPR, can keep you conscious during those terrifying moments when circulation is collapsing. When you cough forcefully, your chest muscles contract and pressure builds inside your chest cavity. That pressure forces blood out of the heart and toward the brain, maintaining consciousness when your circulatory system is failing. Research published in the Journal of the American College of Cardiology showed that repeated strong coughing during cardiac rhythm disturbances kept patients conscious and maintained blood pressure temporarily until emergency treatment could be administered. If you feel your vision narrowing, your head spinning, or your body going limp, take a deep breath and cough hard every 2 to 3 seconds until the sensation passes or paramedics arrive. It is not a cure, but it can buy you the seconds you need. Step 3, and this is the one that research shows can determine whether you survive. Unlock your front door and keep your phone within arm's reach. This sounds small, but in a cardiac emergency, it can mean the difference between being reached in time and being trapped behind a locked door while precious minutes disappear. Paramedics can force entry if they must, but every extra barrier costs time, and during a heart attack, survival rates drop by nearly 10% for every 10 minutes of delay in treatment. If you feel symptoms beginning, your very first actions should be calling for help and then unlocking the nearest door. Move your phone to within arm's reach, ideally on speaker mode so you can follow instructions from emergency dispatchers without holding it to your ear. If you live alone, consider keeping a key in a lockbox outside your door or giving a spare to a trusted neighbor. Step 2. Practice slow, deep breathing. Panic is the enemy of survival during a heart attack. When fear takes over, your body floods with adrenaline, raising your heart rate and blood pressure and forcing your already struggling heart to work even harder. Slow, controlled breathing counteracts this response. It increases oxygen reaching your blood and brain while signaling your nervous system to calm down, reducing the surge of stress hormones that amplifies cardiac damage. Inhale slowly through your nose for about 4 seconds, feeling your belly rise. Exhale gently through pursed lips for about 6 seconds. Aim for about 6 to 8 breaths per minute. Each deliberate breath buys your heart time, reduces its workload, and keeps your brain oxygenated long enough for professional help to arrive. And step 1. Stay as calm and as still as possible. Every movement, every step, every sudden exertion forces your weakened heart to pump harder at the exact moment it can least afford to. Moving around during a heart attack demands more oxygen from the heart muscle, but with blood supply already cut off, that extra demand only increases the damage. Research published in major cardiology journals found that patients who minimized exertion during acute cardiac events had significantly better outcomes than those who moved around in panic. Tell yourself 3 words. Be still. Breathe. You have already called for help. You have chewed your aspirin. Your door is unlocked. Your phone is beside you. Your only remaining job is to stay still. Breathe slowly and let help reach you. These 7 steps form a complete survival protocol. Call immediately. Chew aspirin. Sit upright and loosen clothing. Cough if you feel faint. Unlock your door and keep your phone close. Breathe slowly and deliberately and stay calm and still. Together, they address the most common reasons people die from heart attacks before reaching the hospital: delayed action, panic, restricted breathing, and inaccessibility to paramedics. I want you to do something tonight. Walk through your home and identify where your aspirin is kept, whether it is easy to reach, whether your front door lock is simple to operate with one hand, and where your phone sits when you sleep. These are not paranoid preparations. They are the kind of practical readiness that saves lives. If this video gave you a survival plan you did not have before, please subscribe to this channel. I share new content every week designed to keep seniors informed, prepared, and in control of their health. And please share this video with every senior you know. Everyone over 60 should have this information because a heart attack does not give you a second chance to be prepared. I am Dr. Michael Williams. Thank you for watching, and I will see you in the next video. Stay prepared and take care of yourselves.